Okay, so what I would like to start with is that there are multiple steps to bringing your immune system back into balance, right? So there are many, different things, many different factors that affect your immune health and in turn, your overall health. So if you're dealing with an autoimmune condition or any other chronic illness, or if you just have a whole host of symptoms, unexplained or explained, there's a big possibility that immune dysregulation is at play if your gut is involved. And today I'm going to share with you the first place that I focus on with any of my clients inside my 6-month coaching program, Healing from Within. So in my program, I, of course, guide them through all of these steps. But today I'm going to share with you the first and the most important step because this is the most powerful one. And I don't want to overwhelm you with too much of information at one go. And this is about your gut health, right? Because this is what most people do. They go off gluten, they go off dairy, they might go off non-vegetarian foods, they might go off lentils or pulses or any other foods that don't suit them, or they have read somewhere that it's not good for them. And, maybe they go off for about 3 months and they, may, see very little to no results at all, no improvements, right? And they get disheartened and they give up. So this is where they are. And in some other cases, this is usually happens because they didn't know that there was a step-by-step process. There was actually a 5R process, as we call it, and I'm going to share that in this workshop today. So there is a step-by-step process that we have to follow in a particular order in order to repair and heal our gut lining, and to see the improvements. But here's what happens when people go off these foods without having any such with an understanding how to go about it, without making sure that their diet is well balanced and they're getting in all the nutrients. They start experiencing hair fall, they lose energy or feel fatigued, they have, start having joint pain, they may develop more dry skin than before. In other words, they can actually feel worse than before. And this happened to a few of my clients who had tried these kind of diets before. So working on gut health is the starting point. And today I'm going to share with you the exact 5-step process that I guide my clients through so that you can have the clarity and know where you need to start and what to look out for and what to focus on, right? But before I get there, I would like to start talking about what is the connection, right? Understanding and improving the link. What is this link that I keep talking about? And why is it so important to understand that? So that's where we will start. Okay, let me see. Of how I got here, I come from a finance background, a corporate sales background. Was when my daughter fell severely ill. She had eczema. She's had lifelong eczema, and it sort of just deteriorated. Her condition became worse and worse till the point when she was about 7 years old. She was on already a couple of oral steroid immunosuppressive medications. She had to be put on oral steroids, a combination at one point or the other when she was about 6 or so. And one of these medications put her in the hospital with a life-threatening infection because it shut down her entire bone marrow, right? It's one of those rare side effects. All drugs have side effects. The immunosuppressive medications typically suppress the entire immune system. That's what they do, which is why the symptoms can improve, but that's not really a solution, as we found out. And in her case, it really backfired. That particular medication backfired. She almost lost her life. We were very fortunate that she pulled through, she survived. And that's when I vowed that, we would never be in that place again. And I had to find a more gentler solution for her and actually find a long-term solution by figuring out what the root causes was. And in her case, again, we go back to the gut, because as you will find, most diseases begin in the gut, right? So that's where I come from. So which is why immune dysregulation and eczema has its roots in immune dysregulation. Again, this is so important for me, and the reason is because of my own personal experiences, my own insights, and all that I learned during that time. And of course, couple that with my knowledge and skill sets as a coach, as a functional medicine coach. So that's where I come from. And today we will be covering how disease begins in the gut, the connection between gut health, immune health, what is it that actually links the two of them. This is really important for you to understand so that you know how important is it to work on your gut health. And of course, I'm talking about immune dysregulation and the 5R process. I am focusing on autoimmune conditions in particular because that's mostly what I work with. And there is something called the perfect storm, but most of this will be applicable to you even if you don't have an autoimmune condition. So again, if you have any questions, make sure that you drop in the chat if you're watching this live, and if you're watching this on Facebook or on replay, make sure that you share your questions there in the comments, right? And I'll be happy to answer. So disease begins in the gut, right? What do I mean by that? This slide will actually, explains very beautifully what exactly it means. It means that we often start with these niggling symptoms, and this is usually driven by deficiencies. And this is usually, again, because of digestion issues, absorption issues, where we are not producing enough stomach acid, maybe not producing enough digestive enzymes, which is critical for absorption of nutrients. And that's what drives these symptoms, right? We don't have a disease yet. It's more of a dysfunction. It's anemia, neuropathy, depression, headache, a bit of aches and pains, those kind of things. No major issues right now, just a bit of, aches and pains, actually, small niggling symptoms, which we often tend to ignore. Then it can lead to, over time, if you don't address this, gastrointestinal disease, which is slightly more, intense. The symptoms become more intense. So it is motility, where we can have constipation or diarrhea, microbial issue, infections, hormonal imbalances. So which is why we can start developing even gut-related symptoms. We may not, but we can have constipation, belching, bloating, IBS, all of these things can start developing. Then if that continues for a while, then it can actually lead to GI origin inflammation. Now, inflammation can happen in any part of the body, but this is inflammation driven by your gut, right? Your gastrointestinal tract. That's what GI stands for. So this is, and we'll talk about enhanced gut permeability in a bit. This is driven by that. So then you can actually start having asthma, eczema, as in my daughter's case. That's exactly why I had to focus on gut permeability, migraine, fatigue, fibro. So all these kind of allergies, these kind of issues can keep developing. Again, it may or may not be a disease yet, but all these symptoms and issues can start cropping up. And this can be quite serious, actually, like in my daughter's case. And then if this continues in some people's cases, it might actually lead to autoimmune disease, which is at the extreme end, where we have full-blown immune dysregulation, and it can be any kind of autoimmune. There are more than, I think, 100 diseases that have been named so far. But, it matters, of course, what disease you have, but it matters more what is the process by which this disease progresses, as I've explained to you. Again, if you have any questions, make sure that you drop in the chat, or if you're watching this on replay, put it in the comments below. So the microbial planet is something that we have to wrap our heads around. This is the tens of trillions of microbes that inhabit our gut, which is primarily the lower part of the intestine, which is the large intestine. It is actually a symbiotic relationship that we have developed over millions of years of millions of years of evolution. We have learned to have this give and take relationship where we give them food, the foods we eat, and they give us back in terms of helping us digest our foods, producing some neurotransmitters, regulating our immune system. And that's actually the key here, where dysregulation can actually start. And if something goes wrong, so this we call it microbiome, this collection of microbes, it's bacteria, yeast, fungi, etc., viruses. And if there is overgrowth of pathogenic versus beneficial microbes, then of course we can have dysbiosis, and it's an imbalance. And I'm going to talk about some of the most common reasons why we can develop an imbalance. But the most important thing to understand is that 2/3 of our immune system resides in our gut, right? And there's a reason for that, because our gut is the first line, of control of whatever is coming in through our mouth. So it makes sense that we have maximum police force at that border, right? So that there is no threats that can cross over the border. It's kind of like, imagine your gut lining as the border, and you don't want any threats to cross over into your country, into the bloodstream in our case. So which is why most of the immune system is in our gut, and that's the connection actually, and that's the key. So if you are looking to bring your immune system back into balance, make it healthy, resilient, this is where we need to focus on. So the most common causes of gut dysbiosis are these. So, and you can have a combination of this. So whether it's medication, stress, antibiotics, so they all, sucralose toxins. Sucralose is the artificial sweeteners that we typically have in our, that we use in place of sugar, which is why I do not ever recommend anybody to switch from sugar, regular sugar to sucralose or any such artificial sweetener. I always recommend that you wean off sugar or minimize sugar if you need to, rather than switching over to an artificial sweetener, right? So this is one reason that one thing that is not really well known. Constipation can be a problem, lack of connection to nature, where we are not getting the healthy microbes, from nature, and, having that connection, it's very important. Digestion, hypothyroid function, where we are not secreting enough stomach acid, and as a result, there can be microbial overgrowth in the wrong place. So they, and of course, medication, steroids, and all of them have an impact. So all of these are ways that our gut can go off balance, right? Which is called dysbiosis. And this is the thing to understand, is what is a healthy immune response, right? So a healthy immune response is where your immune system is able to tolerate different kinds of, not threats, but with different kinds of foods and things that come in through your environment, and it doesn't overreact, which is why a lot of allergies, foods look like threat, can start looking like threat, even regular foods, right, to our immune system, and that can cause allergies and issues because of that. So we don't want that to happen. So our immune system should be able to tolerate all of this, right? And when required, it should be able to identify a real threat and then respond, right? That's what a healthy immune system should look like. It should not be underreactive, neither it should be overreactive, right? And I'm going to talk about that a bit, what I mean by that. But this is what a healthy immune response looks like. Whereas what happens in the case of autoimmune conditions is, in particular, food, toxins, and stress are the three most common triggers, and it challenges our immune system, which leads to an inappropriate and overreactive immune response, right? That's just the opposite of that. So imagine that, your police force is basically struggling to deal with the threat because all of them are being overworked. There are not enough of them, and it's a big issue, right? So that's where this analogy comes into play. And in other words, your immune system can become like an overworked police force that is stretched too thin and not able to do its job properly. So a classic example will be of people who have developed autoimmune conditions because the immune system is overreacting to certain things and to their own body tissues. In this particular case, autoimmunity is all about developing antibodies and responding and looking at your own tissues as a threat and producing antibodies. But on the other hand, you are not able to deal with the cold or other such infections that come along, right? So that's where it's not able to do its job properly, and it's stretched too thin otherwise. And the one thing that you need to know at this point is that you don't necessarily need to suffer from digestive symptoms to actually have something that is called leaky gut syndrome, right? I just briefly mentioned it. This is one of the key contributors to autoimmune conditions, but you need not have an autoimmune condition to have a leaky gut syndrome, wherein it's basically, the name is actually enhanced intestinal permeability, because as you can see on the left, the normal tight junction, this is of your gut lining, which is 1 cell thick, as you can see, and the healthy tight junctions are the ones which are selectively permeable and only allow certain digested food particles and things that are only supposed to be in the bloodstream to go from our stomach to our intestine to the bloodstream, and that's fine. That's how it should be working. Whereas in enhanced intestinal permeability, we have faulty junctions. They have become more permeable, that's why it's called enhanced intestinal permeability. And you have a kind of bacteria and maybe undigested food particles, toxins, etc., all leaking into or getting into the bloodstream, and which actually then triggers an immune response. This is one of the key factors of autoimmune disease progression. But as I said, you may not develop autoimmune disease progression, but this is really very common. This can still develop, right? It may not lead to autoimmune disease progression, if you put it this way. Again, it's all there in the workbook. So I've explained all of these, so you can always refer back to that. Enhanced intestinal permeability can also manifest as different conditions. I mean, autoimmune disease is one of them, but skin disorders, psoriasis, eczema, like in the case of my daughter, asthma, arthritis, autism, food sensitivities, thyroid issues, weight loss resistance. So all of these can be linked to that. And the other thing is that autoimmune disease in particular actually develops when you have a perfect storm. The perfect storm is number 1, genetics. Number 2 is intestinal permeability, which we just talked about. Number 3 is a weak or imbalanced immune function. Genetics is obviously something that we can't do much about in terms of the genes that we are born with, but we can certainly do a lot in how we express those genes, and those that depends on the foods that we consume. It's called actually epigenetics. And depends on what foods we consume, what environment that we are creating around us. Environment, I'm going to talk about that. It plays a very important role. So you have these 3 plus an environmental trigger. So it can be inflammatory trigger, it can be a vaccine, it can be a virus, it can be a disease, it can be stress, it can be an infection. So all of these can actually trigger off autoimmune activation, right? So you will have people who have never had any issues, and suddenly they seem to develop autoimmune disease overnight. It's actually never overnight. As you can see, all of these have played a key role over the years. Like none of these, no chronic illness develops overnight. So that's the key here. Again, if you have any questions, make sure that you are sharing your questions here right now. If you're watching this live, or you're putting it in the comments so that I can answer, get back to you later, right? I'll make sure to circle back to you. So I've talked about this again, immune dysregulation, and I've talked about why food toxins and stress, and how food toxins and stress actually the 3 primary contributors to immune dysregulation. Because if food is something that we are not getting, if you're getting a lot of processed foods, it actually can look like a toxin. If it doesn't give us the nutrients that we need, then it can actually increase, we can actually develop an immune response to these kind of foods, because it will look like a toxin to our immune system, and our immune system will always err on the side of caution because it tries to keep us safe, right? Our immune system is actually always trying to protect us, but it might not be able to differentiate between if you are consuming too much of processed foods, right? It can actually start all the preservatives or the chemicals or the flavorings, additives. If they can actually look like toxins to our body, and they do, because the immune system doesn't recognize them as food. The toxins, of course, all by itself, are all the chemicals that we use in our everyday life, whether we are breathing it through the air from the air pollutants in the air, the personal care products that we use on our bodies, the creams, the lotions, the shampoos, all of them, can, play a role in this, and we can actually take in all these toxins, the cleaning agents, the laundry. So pretty much everything that we are using in our house, day-to-day life can be, can be quite toxic. And actually, this is one area also that I cover in my program, because toxins, they not only deplete nutrients, because we use up more nutrients to get rid of these toxins, they increase stress in the body, and they can also at the same time impair detoxification capabilities of your liver. So it's like a double whammy. On the other hand, you're not getting the nutrients for your body or your liver to function properly and detoxify. On the other hand, it is impairing detoxification. So it's kind of creating a huge, vicious cycle. And stress can be psychological, where we are, and there's a reason why psychological stress affects our gut, is because there is a gut-brain axis. I will not be talking about that in this particular workshop, maybe in the future. but there is a direct connection between our brain and our gut, which is why psychological stress can actually affect our gut microbes. But even physiological stress, if we are not, again, getting the right nutrients, if we are having foods which our immune system considers to be a threat, so all of these can actually, that kind of stress can actually have also a big impact. So these three things, food, toxins, and stress, then can lead to our immune system, as you can see in this, slide below, that an ideal immune system is appropriately tolerated. It should be in the middle. So that is where that's what a healthy immune system looks like. So it should be neither overreacting, not underreacting, right? So when you are underreacting, then you actually have maybe chronic infections going on all the time, maybe yeast coating on your tongue, vaginal infections, right, UTI. So these are all signs of, or IBS, all signs of chronic. And if it's, if it's chronic, obviously, if it goes on, right? And it can be very severe infections also. So that's underreactive immune system. But whereas on the other side, you also can have an overreactive where you have allergies, where you have eczema, asthma, which is what I shared with you about my daughter. So in her case, it was more of allergy and eczema. And then you can also have an extreme case where you have the autoimmune disorder, where your immune system is also reacting and responding to your own tissues as a threat, right? So that's what autoimmune is. That's why it's called autoimmune. So you can be on either side of this scale, but what we really want is to be in between. And the 5-step process that I'm going to take you through is going to help you to do just that, right? To figure it out. While you're doing that, I will continue with this. So I'm going to briefly touch upon inflammation, right? Inflammation is necessary for survival and human functioning, because I want you to understand what really goes on when we trigger an immune response, right? Obviously, we know that immune system is there to protect us, and inflammation is a very natural response where the immune system throws out these inflammatory chemicals, but it's necessary for survival and human functioning, because I don't want you to think that inflammation is necessarily bad. And it's necessary for countering any kind of threat, like when we have any wounds, and we need to have a inflammatory response. And that's what keeps us alive, or for healing. And if it continues without, so basically what it should mean, ideally in an ideal situation, is that inflammatory response is switched on and then it is switched off when the threat is over. That's what it should look like. Because if it doesn't, that is evidence of the body's loss of tolerance, because that means you have ongoing inflammation, right? The immune system is kind of sort of switched on at all points. It's not switching off at all, even after the threat is over. And then we can end up having chronic inflammation, and it can actually result in all these kind of diseases, as you can see. So chronic inflammation is actually at the root of many of these chronic conditions that we are facing in the 21st century. So which is whether it's cardiovascular disease, whether it's neurological disorders, diabetes, of course, is a big one. Alzheimer's is also known as type 3 diabetes, diabetic complications, metabolic disorders, cancer. All of these have inflammation as a part, because they all stem from immune response, right? So this is a pretty important thing to note here. Now we sort of switch gears a bit and we move to what actually can we do. Now that you have understood what is at play, now that you have understood what's really going on, what can you do to get your body or immune system back into balance? What is the road to healing, right? When I talk about healing, and the reason I don't ever use a word cure is because I work with women with chronic illnesses like autoimmune conditions, and I mentioned that. And what I'm sharing with you today is the first step, and one of the most important steps that I take them through is focusing on their gut health, right? There are multiple steps that I take them through in the 6-month coaching program, but today is the first one. And the reason I don't really use the word cure is because there may not be a cure for a particular chronic illness, and most of them don't have any cure in the conventional sense, but they can certainly be healed, can certainly reverse or stop the disease progression, disease activation, reverse the symptoms. And I've done it with my daughter, and of course I've been doing it with my clients over the last 6 years, right? Where you can actually reverse many of the symptoms and make them almost, or if not symptom free. So I had a client who just finished working with me. Yesterday was her last session, and I was so happy that when she came to me, she had over 138 symptoms, and some autoimmune thyroid and all connected issues. And yesterday, when we stopped working together, she had 36 symptoms. So that's one of the ways that I keep a tab on, are we on the right track or not the only way. So from 138 symptoms, we actually could reverse about 100 of these symptoms. And, a lot of them were not unexplained, but, doctors were not able to, or, she was not able to connect the dots, right? What was going on? Because they were all connected at the gut. We focused on the gut health, the immune health, exactly what I'm teaching you today, right? So that's the beauty of doing it in this manner, in a very different way, right from the root level. So as you probably can make out by now, the key to a healthy and balanced immune system is your gut, right? Your gut health, to be specific. Because as Chris Carr says, I don't know if you've heard of her, she's a health activist and she is a cancer survivor, and she now helps other people to get their lives back on track, to become healthy. And she says your gut is literally the epicenter of your mental and physical health. So whether you want better immunity, digestion, clarity, balance, focus on rebuilding your gut health, right? So that's exactly what we're going to talk about after this. And it is, as I mentioned, it is a 5-step process, right? And the reason why most people fail to see any improvement by changing their diet is because they stop at the first step, which is remove, right? I'm going to talk about all of them. So removing certain foods, of course, is very important, but it is only the first step. So remove, replace, reinoculate, repair, and rebalance. And let's just go through each of these. If you have any questions till now, make sure that you drop it in the chat. Any thoughts, anything that you want to share, anything that you've learned so far. And if you're watching it on replay, make sure that you drop it in the comments below. Give me a thumbs up if you're finding the information so far, or drop me an emoji here in the chat if you're finding this information to be valuable and useful for you, right? So I know I'm on the right track. Okay. So remove is removing what is necessary for maintaining, to be getting your gut into balance, right? So whether it's stress, whether it's processed foods, whether it's removing or dealing with constipation, whether it's dealing with an infection that might be going on, harmful microbes, all of these toxins, mold, right? All of these things, foods, of course, which are triggering an immune response. Typically, the foods that trigger an immune response are gluten, which is a protein found in all wheat products, rye, barley products as well, and dairy. These are all anti-inflammatory foods. Gluten has a special role here, and it actually also has a role to play in enhanced intestinal permeability, which is why it is one of the first foods that I remove for anyone who has any kind of autoimmune disease, irrespective of the diagnosis, and also for most of my other clients. It really goes a long way. So it's part of the remove process. Medications maybe that you're on, and if they are not necessary, and it has to be done appropriately, of course, but all of these, there can be many different things that you might need to remove. It can be negative beliefs, it can be toxic relationships. So all of the things that are impacting your gut health, and all of these do impact gut health, is what we focus on in this first step, right? But most people, as I mentioned, get stuck at this particular step because they don't know that, what needs to be done after this. And that's why most of the times they don't really see the results. So using your workbook, you can just jot down so that, it's sort of, you're able to sort of take it in. That's why I've kept those blank spaces. So that's remove. Then you have replace, right? And if you notice that I'm following it in a particular order, and there's a reason for that, so that, we don't have unnecessary aggravation of symptoms, and you may not see the results. So we have to follow it in a particular order. So it's always best to work with a practitioner or a health coach who's been trained to help you with this. So replace can be replacing digestive enzymes, stomach acid, and it's much more common than you think. Low stomach acid issues, bile salts. Bile is produced by our liver, and it helps to break down fat. And there can be all kinds of, we can use bile salts as supplements. I have used HCl supplements to replace stomach acid. I use a lot of digestive enzymes, because most people who have chronic illnesses have poor digestion, absorption, issues. So we need to support their gut digestion and absorption for the time being, like in the short to medium term. So with the help of supplements, we replace all of this. And we can also replace some bad habits, the way we drink or eat. And I'm going to talk about one particular, thing that you can start doing today. So make sure that you stay till the end. That's where you can start. It's a very simple thing that you can focus on, but extremely important and effective, right? So replacing your all of these is very important, and it's a necessary second step. Also, of course, I also do replace any nutrients, missing nutrients, because when you have poor digestion, then you will automatically have, be low in nutrients like iron, zinc, magnesium, vitamin D, all of these kind of things. So it depends. But of course, you need to know what you're deficient in, what you're low in before you can proceed with all this. Reinoculate is something that many people are aware of, very new, actually take in probiotic foods, fermented foods, and prebiotics. Prebiotics are foods that the bacteria actually feasts on. So prebiotics and probiotics are two different things, right? If you're having enough vegetables, if you're having enough fiber, you're already getting, by and large, the prebiotics that your gut microbes need in order to thrive. So you don't need to add separate prebiotics, but some probiotics, which is cultured bacteria, also come mixed with prebiotics. So depending on what your body needs is what you need to look for. But having fermented foods is this is where we reinoculate with fermented foods. If you have dairy intolerances, if I've taken off my clients off dairy, which I often do, then we find alternatives, whether it's through supplements or maybe it's fermented coconut yogurt. It can be fermented almond milk. So it's almond yogurt. There are many different options. Kimchi, sauerkraut, which can be made at home. Homemade pickles, right? Not with whole host of oils, etc., but homemade. So they all work in reinoculating. Repair. Now, as we are doing this, we need to make sure that we stop the gates. Like sort of basically, it's as if we have enhanced intestinal permeability, it's as if the gates are open right now, because the tight, as you saw, the tight junctions have become they are not semi-permeable or selectively permeable anymore. They have become more permeable. So then that's why we are having an issue with an immune response. So we need to also repair that gut lining, and we know that we need to repair so that those that structure is called the villi on the cells. But basically nurturing that layer is filled with mucus. It basically helps to protect that lining from the effects of stomach acid and digestive enzymes. So we need to repair that, and it can be done with aloe vera, marshmallow, slippery elm, okra is, which is your basically, as we call bhindi, ladyfinger. So all of this, but it's of course more difficult to get all of, and zinc plays also plays a role, and so does vitamin D as nutrients. But it's of course quite difficult to get all of them and implement all of them. So there are certain supplements that I use with my clients who need this particular who need to focus on this particular area. Not everybody has an issue, such a big issue, but many of my clients with severe illnesses do need a gut repair supplement, which repairs the gut lining. And you have a lot of supplements which come with all of these, right? But we also, apart from this, we need essential fatty acids. We need to go off gluten. We need vitamin D. We need to increase our vitamin D levels. So all of these have to go hand in hand, right? So that's where the repair comes in. So basically, we are closing the gates so that we don't continue to trigger, and every time we eat, we don't continue to trigger an immune response and have inflammation, and then basically move towards autoimmune disease activation. So the last but not the least is, once we are able to do all of this, we also need to make sure that we are able to, it's more of rebalancing. So making sure that we're able to stay where we are making long-term dietary changes, we are working with different stress management techniques so that we find relief from stress. We are sleeping properly, we are moving our bodies, all of the vitamin J, as we call it, which is J for joy, right? Community, being part of communities, having healthy relationships. These are all aspects, softer aspects, but equally important aspects of making sure that not only do you get well, but you also stay, right? It's not just about following a fat diet for 6 to 8 weeks and going and then stopping everything and then going back to square one, right? We want to ensure that we get better, we feel better, we have more energy, we feel healthier, we feel happier, and we want to stay there, right? So this is where rebalancing is important. Sense of purpose. So this is all of it is there. And I help my clients to actually uncover their purposes in life. Okay, Shweta has a question. I'm just going to read the question for those who are not here. Going off gluten should be followed temporarily or permanently if you have an autoimmune disorder. Shweta, so the fact that a person has autoimmune disorder means that they will have, as I mentioned, the three things that the perfect storm. One of them is enhanced intestinal permeability. Now, unfortunately, gluten is one of those proteins which contributes to enhanced intestinal permeability. So if that person really wants to basically not only reverse their symptoms, but also stay well, they will need to be off gluten and will for life, right? So that's because once a body produces antibodies, they will remember it. That's what keeps us alive, right? That's the reason that when we take a vaccine, or suppose we have chickenpox at some point in our childhood, typically we will not develop chickenpox or measles or something. Or if we've taken a vaccine, either a vaccine or we've developed a disease, the reason we don't develop the disease again and again and again is because our body remembers, our immune system remembers, and it protects us by developing antibodies and getting rid of the threat even before it becomes a problem. We don't even realize it, right? It's always working in the background. Now, unfortunately, in the case of gluten, if a body has already developed antibodies, which it does in the case of autoimmune conditions, as I mentioned, because enhanced gluten itself contributes to the problem of autoimmune disease activation, then it will be very highly likely that whenever you have gluten, that's going to actually keep contributing to the problem. So what I tell my clients is that we go off gluten for at least 6 to 8 weeks. Then we do reintroduce, right? Just to see how our body reacts, etc. It's called reintroduction. There is a step-by-step process. It's called an elimination diet. We go off gluten, dairy, and a few other foods, which we know are usually a problem. We can do a test, but not always necessary. But what is important is doing this elimination for a while. And then when we reintroduce gluten or one at a time, that gives us the sort of, what should I say, sign or signal whether our body is able to deal with it or not, right? Even if I tell you, you will yourself understand whether your body is having an issue with that. And most people, obviously, once they start feeling better, they opt not to go back to that diet. I hope, Shweta, that answers your question. I know it's a long answer, but I wanted to just explain that. If there are any more questions, just drop in again. I'll make sure to answer that right now. And if you're watching this on replay, make sure that you drop in your questions in the comments below. And again, I will be getting back to you. So we've come to the last part of the presentation or the workshop today. And I want to leave you with some actionable things that you can start doing, right? Actionable because this is, as you've realized, gut health is the key to reversing autoimmunity and many other chronic illnesses, because disease usually begins in the gut. And this is where you can start, right? Eating hygiene. Now, it can sound very basic. It is basic, but it's something that is usually not followed because people usually underestimate the importance of eating hygiene. And I'm just going to talk a bit about this. And of course, as I said, you can make your notes, but these are the things that we need to keep in mind, right? And you will be amazed, or you'll be surprised by how much improvements you can see just by following a few of these things, right? So this is something that I teach my clients right at the beginning so that they can start seeing some improvements from day one. So one is to slow down, right, while eating. And it's easier said than done. We know that. But digestion takes time, and digestive secretions like stomach acid, bile, enzymes, they need time to be fully secreted. So if we are rushing through a meal, then we are not able to actually produce or secrete these all these digestive juices, and they're not able to break down the foods that they should be, because if they don't break down the food, then we have issues down the line, right? And if we are stressed, it takes even longer. That's what it is. And we know now that if we are stressed and we are eating, that can actually reduce our stomach acid production by as much as 75 to 80%. 75 to 80%. Okay, so which is why eating hygiene is so important. So not, gulping down your meal in a hurry, or not having food when you're highly stressed, or paying a bill, so these are not the times, or having a fight, not the times to eat, right? So we need to calm ourselves down. So ensure that we are maximizing our digestive juice output, secretion. Also, it takes our gut about 20 minutes to signal to our brain that we are full, right? So if we don't want to overeat, and we want our brain to basically understand and tell us, tell our body to stop eating because we are full, it takes about 20 minutes. So we need to give our bodies that much of time. So slowing down is the first thing that we need to do when we are eating. Secondly is chewing, right? Believe it or not, we only chew our food for an average of about 6 times before we gulp it down. That's not enough, right? It's such a basic thing. We've been doing it since we had teeth, but again, this is not something that we really appreciate. And chewing is the only part of the digestive process that is under our control. Rest of it, once we gulp it down, it is out of our control, right? We can't really control it. So the less we chew the food, the harder our GI tract has to work. The gastrointestinal tract has to work. So it also a lot of times creates fatigue after we eat, because the food was not digested properly. And also when we swallow chunks of food, our digestive enzymes it makes it difficult for them to do their job.